We've all heard different opinions about getting vaccinated against COVID. Well, there seem to be even more mixed reviews for women who are pregnant. So we want to ask an expert. Dr. Mimi Munn is a maternal fetal physician with USA Health. Thank you for being here, Dr. Munn. Would you say COVID vaccines are safe for a pregnant woman and her unborn child?
Good evening. Thanks for having me. There's not a whole lot of data about the use of the COVID vaccine in pregnancy because the pregnant women weren't included in these studies. But everything that we are learning so far from women who got the vaccine either inadvertently or have been enrolled since we started offering it, the news is very encouraging, and we have every reason to believe that the vaccine is safe in pregnancy.
Dr. Munn, we've been following the story of the 911 dispatcher in Mobile who got COVID. She had to deliver her baby early. Now the mother is fighting for her life. Would you say the potential side effects of the vaccine for mother and child are safer than actually contracting the coronavirus?
Absolutely, absolutely. And that, I think, is what needs to go into a woman's decision-making process when she's trying to decide whether to get the vaccine, is that, yes, we know that pregnant women, if they get COVID, have a much higher risk of mortality, of death, of ending up in the intensive care unit. So, yes, I think that women should seriously consider the vaccine for that reason.
What are the risks of the vaccine in pregnant women?
We haven't seen any major adverse events, just sort of the normal side effects that have been reported by most people, with pain at the injection site, myalgias, fever. So no major concerns about it in pregnancy right now.
Okay, because the vaccines haven't been on the market for a full year, a lot of women do worry about the potential effects on the child years down the road. What would you say to those mothers?
Right. Yeah, and those are legitimate concerns. There's currently a registry that's enrolling pregnant women who have received the vaccine, and they're following about 3,000 or 4,000 now that are in the third trimester or have delivered. Over 200 women have delivered that got the vaccine, and everything seems to be reassuring. There does also seem to be some passage of the antibody and found in the umbilical cord to the baby, which makes us very optimistic that this will also hopefully protect the baby as well. So you are correct that we don't have any long-term data, safety data, but everything so far is very encouraging. And again, we know that COVID can make a pregnant woman very, very sick.
Right. Dr. Munn, we've also heard that the vaccines could potentially cause fertility issues. Is there any truth in that?
There's no truth in that. The studies looking at that have not suggested that there's any increased risk for miscarriage or the inability to get pregnant. So we have no reason to believe that is true.
Okay, so are you personally encouraging your pregnant patients and those who would like to try to get pregnant in the future to get vaccinated against COVID?
We're participating in a shared decision making with a patient, and it's an individual decision made on a case-by-case basis. And this is what I tell my pregnant patients: if you are healthy and a marathon runner, and you work from home and aren't exposed to people with COVID, you may want to wait and get the vaccine after more data is out. If you have some comorbidities, you're diabetic, obesity, hypertension, and you work in a place where you might be exposed to COVID, say in a hospital, I would seriously consider getting the vaccine. So I think it's a very personal and individual decision that the woman should make with her healthcare provider.
Great to hear your thoughts. Thank you again, Dr. Munn.
You're welcome. Thank you.